Is EHR. EHR is a digital version of a patient's medical chart that healthcare providers use to store and manage electronic information. On this picture, you see a whole bunch of information telling you the good things about what EHR does. On the left-hand side, it gives you an example of a patient calling in asking for about 5 years of records. And back in the days, that's how records were stored. But now with EHR, we can just go to a system and access the records without a wait, without all the paper. Here's the benefits of EHR. This slide talks about EHR improvements. Electronic health records improve care coordination by storing long term patient data information such as diagnosis, such as lab work, such as appointments, any information that the patient may need. And it can be shared across several different healthcare networks, not just one provider, but say someone needed to give information to their medical from their original or a referred provider to their primary provider. They can access this all through the EHR system. Electronic health systems store all information with great security and precautions. Electronic health records use multiple layers of security to protect the patient information. It allows patients to securely view their own health information, their lab information, their portals, and access to their passwords and sensitive information, but it allows them to do it knowing that everything is encrypted and it has restricted access so that none of their information can ever be shared. Why is EHR needed? If we ever think back, we think back to all the paperwork and all the errors that was done on paper, all the handwriting errors. So why is EHR needed? EHR saves time. EHR has less paperwork, less duplication. Let's be honest, that happens a lot when you're handling papers. EHR makes healthcare much easier and efficient teamwork. EHR help avoid mistakes and improve diagnosis. EHR altogether makes things good, not only for the provider, but for the patient as all. Everything could be accessed in one place. What a great idea. Next slide is called Beginning Visual Examples of EHR. Clinical decision supports a system that helps healthcare providers offer alerts and reminders during patient care. Look, here's a picture up here where we're showing that a drug interaction does not go with another drug interaction, or a patient is allergic to this medication, or it's a high risk alert that maybe the patient doesn't need to take this medication. Maybe it needs to go back to the provider to maybe look at a medication. Electronic prescribing, when a doctor can just go in the system and put in simple things and it goes over to the pharmacy. It's no longer writing it down, it's no longer making it long or a hassle for the patient. It's just easy for the patient to go pick up and easy for the provider to just send over. More positive examples for EHR. Here we see on the screen is a patient portal. The patient is looking up their test results. A patient is looking up their appointment. A patient is even able to see their bill and if they owe anything, if there's anything that they need to send in. They can follow up on their test results. All the information is right there. Say a patient is going to the provider and they had to get a TB skin test and they wanted to hurry up and get the information back and not have to go back to the provider's office to get the TB skin test read. Here we are. Test results is right here. That's so much easier. Okay, so we're on the last page of EHR examples. Here we see here is a clinical documentation page. We all know in order for a provider to treat anyone in a fair way, they have to go through several steps. We know that they have to properly diagnose them, right? We know that they have to properly have a treatment plan that goes with the diagnosis. And we also know that they have to follow each and every one of the treatment plans to see how is it working. Here we are of a picture of the EHR system where they're able to do this all at one screen. No different things, no different papers, no different screens, no different system. They're here. This cuts out a lot of mistakes, a lot of somebody not seeing what was diagnosed, what was the treatment plan, how the patient may have been doing on that treatment. This right here tracks everything all in one place. Here we are on slide 10, and that is EHR made simple. Here we are, we have a picture of a patient's chart. One click of the patient's chart, it shows all the information. It shows the blood pressure, it shows the heart rate, it shows the oxygen, it shows all the information needed. EHR made simple is basically just saying that we have easy access to get the things without taking a long time or without going multiple routes. Here's the easy way. Here's an example on slide 11 of EMR versus EHR, electronic medical records versus electronic health records. And here we present the differences of each and every one of them that determine what is best for that patient or even what is best for that facility. We are on slide 12, and this is the end of our project. This is see the ease in the action. Find the patient, instant search or instant scan, review history, document visit, order and close. I hope that throughout this presentation, you were able to see the benefits of the EHR system, and I hope that in the future, you look forward to partnering and becoming an EHR patient. Thank you.